Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today I'm talking to Dr. Clare Scullin and Dr. Joanne Brown from the Medicines Optimisation and Innovation Centre in Belfast. And we're talking about the iSIMPATHY project, which is about how we're tackling polypharmacy. That is, the question of multiple drug therapy. Dr. Scullin, Dr. Brown, why don't you start by introducing yourselves and telling us a little about your role at the Medicines Optimisation and Innovation Centre?
My name is Clare Scullin. I am a Senior Research and Innovation Programme Manager within the Medicines Optimisation Innovation Centre in Northern Ireland, and that is quite a mouthful. The Medicines Optimisation Innovation Centre is the only dedicated medicines optimization centre in Europe, and we are funded by the Department of Health in Northern Ireland. We're based in the Northern area, our Northern Health and Social Care Trust, and we're uniquely positioned to work alongside both the health sector and the private sector to deliver better patient outcomes around medicines optimisation. And in terms of my own role, I am one of a team of programme managers that work in the centre. And we generally have a portfolio of projects that we will work on at any given time. To date, I have focused on medicines optimisation, the ever-evolving medicines optimisation that's been happening in the Northern Trust over this past 20 years, really. And at present, I am the project manager for the iSIMPATHY project, which is a joint collaboration between ourselves, the Republic of Ireland, and the lead partner in Scotland.
Thank you very much. My name is Joanne Brown, and I'm one of the 3 clinical pharmacists who are working on the iSIMPATHY project in MOIC and in the Northern Trust. And I suppose we should say what iSIMPATHY stands for, which is implementing, stimulating innovation in the management of polypharmacy and adherence through the years. So we are a team of pharmacists who are working on the ground to deliver the medication reviews, see how we're getting on as we go through it, and collect our data and onward dissemination and training to other staff.
Let's get right into the topic. What is the background to the iSIMPATHY project?
The iSIMPATHY project itself follows on from a successful European-led project, Sympathy, which was also led by the Scottish Government. And it was a project in which we were involved in as well. And it was really a European-wide project to tackle the growing global issue of inappropriate polypharmacy. And we worked with a number of European countries where we tried to determine what level of polypharmacy guidance there is out there. And what we ultimately discovered was that there actually wasn't a lot. So iSIMPATHY is sort of building on that and using some of the information that we learned from the Sympathy project to address the issue of inappropriate polypharmacy.
And tell us, what is polypharmacy and why does it matter so much?
Polypharmacy is taking a number of medicines, and it may not always be inappropriate. So there are times when it is appropriate to take lots of medicines. We have patients that have lots of morbidities. But sometimes polypharmacy can be inappropriate, and that might be where the medicines are no longer suitable for the patient. We've aged and our kidneys may not function so well, and lives change, lifestyles change. We may have a number of prescribers who are prescribing for the one patient. There may not be great communication there. And patients may not get the intended benefit that was expected from their medicines. And also adherence, it can be quite difficult for patients to be adherent to lots of medicines. And we know that if you take one medicine, there's about an 80% adherence with that. But once you're getting into more than 4 medicines, adherence drops to 50%. So we're asking those questions, are you taking your medicines? And we certainly know that the more medicines you take, the more likely you are to have an admission to hospital. So If you're on more than 10 medicines, you're 300% more likely to be admitted to hospital with an adverse drug reaction. And that costs a lot of money annually. Globally, it's something like £18 billion is spent on adverse drug reactions, and 8.2 million admissions every year in the EU to hospital with adverse drug reactions. So it's a big, big problem. But we have to remember that each of those adverse drug reactions are happening to a person, to a patient, and it's that patient who is suffering the ill effects of medicines, coming to harm, getting admitted to hospital. So we need to always bear in mind that patient. And that's what our iSIMPATHY reviews are aiming to do, is to increase adherence, but to decrease this inappropriate polypharmacy that could potentially cause harm.
Those are huge numbers. Were there any specific recommendations from the Sympathy project?
Yes, there were 6 key recommendations from the Sympathy project. The first of which was to use a systems approach with a multidisciplinary clinical and policy leadership to then nurture the culture that encourages and prioritises the safety and quality of prescribing. We wanted to ensure that the patients were central to that decision making, and that they felt empowered, that they were able to play that part in their own medication role. We obviously, with everything, you need data to drive the change and to measure those outcomes. We want to adopt this evidence base, and lastly, want to utilise, develop and share the tools to support the implementation. So our iSIMPATHY program will train pharmacists and other healthcare professionals to undertake structured medicine reviews in line with the guidance and the best practice that we developed during the initial Sympathy program.